to introduce such an impressive group of panellists who are involved in a range of programmes of work covering things as diverse as digital, training, changes in practice. It just shows the diversity, I think, of CGHP and the partnerships that are developing. So the first speaker tonight is Tamsin Holland Brown. So she is a Cambridge-based community paediatrician, founder of Hear Glue Ear, a really impressive piece of work that she's done. Co-clinical lead of the NHS Clinical Entrepreneur Programme, and she specialises in children who are deaf, with a particular focus on children with temporary hearing loss due to glue ear. This led Tamsin to create an affordable listening device to improve hearing and an app to improve developmental skills and self-management of glue ear. And this was particularly valuable to families during the COVID pandemic, when face-to-face appointments and operations were often unavailable. But the device and app has won innovation and paediatric awards across the board, with NICE highly commending the app and the UK App Awards awarding it Children's App of the Year in 2019. But tonight, Tamsin's going to talk about her research and a little bit more about the innovative headset, how it works, but also the impact it can have for deaf children accessing education outside of the UK, particularly in Malawi, a country with a high burden of middle ear disease and preventable hearing impairment. Tamsin, over to you.
That was a very lovely introduction. Thank you so much. So I work as a paediatrician in Cambridge, and I had been worrying about the population of children that I was looking after, because whilst I did my paediatric clinics, I was also doing children who had hearing loss. And interestingly, children get hearing loss actually really commonly. You know, when you get a cough or a cold and you get really blocked up and you can't hear very well for about a week, because children have such small anatomy, they get blocked up really easily and for much longer, and that can cause deafness. And of course it's hard if you're doing that as you're starting school. And whilst you could, if that persists, you could have a little operation to drain that fluid and put a little grommet across, or you could try a hearing aid. Hearing aids don't work terribly well for this condition because it fluctuates. That actually you would probably wait around a year, and that was before COVID, in order to get that grommet operation, just because you need to go through several clinical appointments before you get there. And the one hearing aid that works really well for this condition is, you look a little bit like an 80s tennis player, but it works brilliantly because it takes sound, turns the sound into a vibration, and sends it across the bones of your skull straight to your inner ear. And that works brilliantly if you've got mucus and fluid blocking the middle part of your ear. So this works really well, and all I wanted to do initially was a research study using that type of hearing aid. But as my colleagues told me, it was pointless to do that because they're so expensive. They're £3,000 each, and we're talking about a lot of children. And so people said, even if you do the research and prove it's useful, what do we, we can't, the parents can't afford it and the NHS can't afford it. And so because of that then, my soul was slightly crushed, but I ended up going to an electronics store and asking them how much a transducer was that takes sound and turns it into a vibration. And it turns out that that's about £9. And so actually you can build your own for about £13, but it's horrible and it's got wires everywhere. But there was already looking for things that were already on the market. And these little running headsets were just emerging actually when we were thinking about this sort of 7 or 8 years ago. And they sit in front of the ears and use the same type of technology. And so this headset costs £25, and the vision would be then that not only could you help children to hear, so you could have a child wearing a headset with the teacher on the end of a microphone, or that could be the speech and language therapist or the parent, but also maybe you could connect this directly to a phone or an app, and that could give you speech and language development, enrichment, listening skills, all the things so that children didn't fall behind. And so over a long period of time, I did 4 research studies, and the spoiler alert is that they work and they do their job. And we also created an app to do that speech and language piece as well, so that we could improve their speech and language. And that means that we could help children as soon as they're deaf, and they don't have to wait in this long pathway to get to the point where they're waiting 1 or 2 years at a very critical time in a child's development. And it was because of that that research that was being presented at conferences, that there was interest, and we're so lucky where we are here because have wonderful whole ecosystem of people who are there to help you to develop. And so Raspberry Pi Foundation helped produce these headsets with all the features that we needed, and we got connected into the network in Cambridge University Hospitals. And I had a wonderful colleague, Isabel, who's an ENT surgeon, who had worked out in Malawi and said, these might work out for you out there. And so she initially took 2 headsets out there to see what they thought of the headsets, but because of the COVID pandemic, we didn't get to travel there until about 3 years later. But when we went 3 years later, the children had been using the headsets for 3 years to be able to hear. And this is a wonderful schoolgirl who had been using it and repaired it when her friend accidentally trod on her bag, so that she could access speech and language and was able to pass exams, having not been able to pass exams beforehand. And then we wanted to do a very important piece, taking these to a deaf school out in Malawi to ask them about having a stigma, whether they would wear these, what they sort of, whether they thought these were acceptable to use because they're very visible. And we were told actually that while we were doing this in the deaf school, that actually they were profoundly deaf and these wouldn't particularly work. But in fact, as you can see, the kid at the back started responding to having headsets on. And so his teacher, because he can lip read and sign, put a little microphone on but turned away from him and asked him to stand up, and then asked him to raise his hands. And then there was this ability really to see that we may be able to help far more, or enable these far more across not just Malawi but other countries. And what the worry was out in Malawi is that there were boxes and boxes of hearing aids in the hospital. That wasn't a problem. Donated hearing aids were there, but nobody was wearing them because there was no access to the batteries, and the batteries were expensive, and they couldn't find them. They couldn't source them. So, in fact, a colleague, Catherine DeCates, came out and did a lovely piece of work where this is the audiologist who came with us to local stalls in Malawi looking for how we could power these, because they're charged like you would charge mobile phones. They have no batteries in them. So she did a lovely piece of work finding the right solar-powered charger that meant that we could keep this all cheaper than one set of hearing aids, and enable them to do it. And we were very lucky to get some awards around here, but actually what you don't see there is the 10 pages where it's been a long journey and there's been many failures, which I think is just part of a journey when you're doing something innovative, where there's many ways that it fails, there's many headsets that don't work, and it's hard to get to the point where you've done the research and you're able to combine and work with colleagues to get it out there. But we would really love to connect with anyone who's interested in this, and it's something that we're rolling out not just in the UK, but are interested where we can go and get global health. Thank you.